Hello, I am Dr. Silas, practicing rheumatologist at Baptist Hospital, Bangalore. Today, I'll be discussing osteoarthritis with you all. As you know, osteoarthritis is a progressive degenerative disease of the joints. Mostly affects the knees, the hips, and also the small joints of the hand and other joints too. The main thing that happens here is the cartilage of the bones gets eroded during the course of life due to wear and tear, and especially in the elderly people, this can lead to joint deformity, degeneration, and various other complications. So, this disease mainly affects the elderly, but in some conditions can also be seen at an earlier age. So, what are the main symptoms of this disease? This disease mainly causes pain. This pain can be usually seen as the person keeps walking around, climbing steps, might find it difficult to carry out that person's daily activities as the disease progresses. It can lead to difficulty in squatting, sitting cross-legged, and doing other various things that normally a person could do when he was younger. And coming to the other symptoms, they can be sometimes mild swelling in these joints and also disability that prevents them from moving around easily. Now, coming to what exactly happens, if you put it in lay words, you can think of a tire that has rubber. So the rubber, as it wears out, the empty steel of the tire is left, and that's how you can think of osteoarthritis. The elastic cartilage part of the bone gets eroded, and therefore the bone part of the joint is present, and it starts eroding and causing deformities and pain. Now, how do we manage or evaluate these patients? A simple X-ray of the knee or the joint that is affected usually is enough to diagnose osteoarthritis. We don't need to further evaluate unless it is early stages or there are associated symptoms that the doctor wants to evaluate. A doctor is planning to further intervene in the form of surgery. They might ask for other tests, but usually an X-ray of the particular joint, especially the hip or the knee, is enough to evaluate. So, coming to treatment, you can broadly divide the treatment into pain management, rehabilitation, and improving the quality of life. So, when you come to pain, the doctor who you see might put you on analgesics or pain medicines to relieve the pain. You can use a topical or a local application of a pain gel initially, but in cases where that is not enough, sometimes you might also be put on some pain medicines. If this is not enough, then sometimes the doctor might advise various other modalities in the form of surgery in late stages when the joint is deformed and it is affecting your quality of life. So, the other aspect of management is physiotherapy and exercise, because it's also important to strengthen the joint. We need to strengthen the muscles around the joint so that the mobility improves, the damage is delayed, and also the quality of life improves. So, it is important that the treatment from a doctor or a rheumatologist is also hand in hand with the physiotherapist treatment. So, you can have a tailored, structured treatment when you visit the physiotherapist according to your mobility, flexibility, and also how much you can do. They can tailor the exercises so the muscles around the joint, especially the quadriceps in the knee, can be strengthened so that the damage can be delayed. Coming to another aspect is diet that most patients ask. Is there any specific diet that we can follow to delay or to prevent osteoarthritis? So there is no specific diet, but a balanced diet is important, especially diet that contains less fats. Weight gain should be avoided, and good balanced diet is what we'd advise, and maybe supplements containing vitamin D and calcium can also be advised. Coming to further management, sometimes if the pain is not relieved with analgesics and also physiotherapy, sometimes we can also sometimes inject the joint with various products that can relieve the pain and give you some comfort for few months. Now, if all this fails, then yes, in certain conditions, we do advise surgical intervention in the form of joint replacement. So, to summarize, if you had to put it in a nutshell, osteoarthritis is a progressive degenerative disease of the joints, mainly affecting the hips and the knees and other joints too. It usually occurs in the elderly people. Treatment, if started early and if it is picked up early, if it's diagnosed early, then we can delay the progression of the disease. Main treatment includes physiotherapy and exercise, pain management, and also rehabilitation in those perspectives to delay the disease. And in conditions where that is not possible or it is in a late stage, surgical intervention also can be tried. Thank you.